Dr. Oz, first of all, thank you so much for some time tonight. Just tell us broadly about this program first, and for folks that don't know about it, how it's going to work.
So, Tim, the Rural Health Transformation Fund, as the name indicates, is designed to put money into rural healthcare systems which are really suffering in America. About 40% of the hospitals in rural America are in financial distress. Occupancy rates are quite low, about half that in urban areas. If you live in rural parts of the country, and this is true for North Carolina, but other parts of the nation as well, you have a 20% higher incidence of chronic illnesses like cancer and heart disease. And for that reason, your life expectancy is actually shorter. Think about that. Your zip code can predict your life expectancy. And the dignity we should have as Americans should extend to wherever we happen to live, and healthcare is part of the puzzle. And we can do better. So the president and Congress, as they were passing the working families tax cut legislation, and I think this is brilliant, decided they're going to take a $50 billion slug of money, divide it over 5 years, and give it to every state. But the states have to apply. Why? Because that way you know the governor's engaged, and you know the legislature and folks that are decision makers in healthcare are going to actually work together to fix the problems, because so many of them are created by us, by the bureaucracy, by internecine battles that somehow held back licensing organizations from letting people practice at the top of their licensure. So those kinds of challenges that we've never been able to get our arms around, now we can finally deal with. And just to put it in perspective, about 7% of all Medicaid money, and I run Medicare and Medicaid, so I know these numbers pretty well. About 7% of all Medicaid money goes to rural areas, only 7%. It's about $19 billion a year. So by putting $10 billion extra a year in for 5 years, we're actually putting 50% more money into rural America. That should dramatically change, transform the way we practice care in those areas. And I'm hoping that over the course of this discussion, people understand why it's so critical, and they'll get involved. They'll start pushing for their hospitals locally and hopefully at the state level to get the best application possible, because it's due on the 7th of November.
And so, what are some of the things you would expect, because they are applying, these hospitals in rural areas to use this money for?
So let's take the example of the manpower shortage. One of the reasons that we have almost twice as high a suicide rate in rural areas is there's no mental health practitioners. So can we get more folks trained to be able to practice in rural America? So getting a workforce development program in place. And part of that is allowing people to practice at the top of their license. And by that I mean, if you're a nurse, but you're actually able to give advice to a vet living in despair and maybe thinking of taking his life, let the nurse do that. If you can get doctors to be able to do more than maybe what they were normally credentialed for, because the state licensing board sees that as an appropriate improvement in some parts of the state, rural areas in particular, that's a good thing. How about pharmacists? We've got 85,000 pharmacies, Tim, in America. 85,000. That's 17 times more pharmacies than hospitals, which basically means even if you're in rural America, pretty far away from a hospital, you probably have a pharmacy near you. So what about those pharmacists doing more than just dispensing pills? What if a mom has a child that's ill at 10 at night and takes that kid in with a sore throat, and they can get a strep test, because a pharmacist can now do that, and then the pharmacist can work with the doctor to get penicillin to the kid. Now you don't have to drive 50 miles to a hospital. You get to bed, you go to work the next day, kid gets their treatment pretty quickly, and saves us money, because it's a lot cheaper to go to your local pharmacy than drive across state to a hospital.
On the larger bill, our Senator Tom Tillis has said that it will essentially cut expansion to more than 600,000 people in North Carolina and could cost the state $26 billion over the next 10 years. Is he right on those numbers?
No, I've spoken to Senator Tillis, and we have a whole group that provides actuarial tables and tries to calculate out exactly the impact of the bill. Excuse me, let me clarify. This is really important for folks watching in North Carolina. What the bill did, the working families tax cut legislation, was to take away what was done during COVID and restore us to a peacetime agency. We're not at war with a pandemic anymore. I think everyone agrees with that. So the massive additional investments in healthcare that were made during COVID, which were probably necessary, especially early on, aren't needed right now. And if you keep pouring money into the system, you're actually giving it to systems that don't even know how to use the money even that wisely. And more importantly, you're breeding a process that's not conducive to long-term success of Medicaid. Medicaid was designed very clearly take care of folks who are vulnerable. Take care of those at the dawn of their life, the children, those in the twilight of their life, as Hubert Humphrey said, the seniors, those living in the shadows, folks who are struggling with mental health issues, and really need a hand up. It's not designed for working, aged, able-bodied individuals who ideally would get off Medicaid and go into the workforce. We want to push people to do that. So people do criticize the law because they say, well, not everyone's going to get a job. I understand that. But the average person who's able-bodied sitting at home is watching 6.1 hours of television or just leisure time at home. They don't want to do that. They get unhappy, increased incidence of opiate use. People want to go out and change the world. That's why you're put on the planet. So we want folks to go out and do that. And we're going to help make it easy to go out and get a job. But in the meantime, it's going to save Medicaid some money. And we want to pour that money back into the system, like with the Rural Health Care Transformation Fund.
So you don't believe that the states are going to, for a state like North Carolina has a trigger that they would have to drop Medicaid expansion if that match wasn't there at the 90-10 rate. You don't believe that North Carolina is going to have to come up with that $26 billion?
Oh, well, we have a 90-10 match for Medicaid expansion still in North Carolina. That's not changing. What changed in the law, just to be super transparent on all this, was taking away some of the gaming of the system. We've got a partnership. I'm sitting here in Washington, you're in North Carolina, and I'm saying to you, I'm going to pay whatever, I'll pay 90% of the bill, right? That's fine. You pay 10%, but that way you have a little skin in the game. And what if you have a system for reducing your ability or need to pay that 10%? What if I pay 100% and you don't pay anything at all? Well, how do I know you're making the right decision with my money? And after all, my money is sort of your money because I'm taxing you, but I'm also taking money from South Carolina and I'm putting into North Carolina then. That's not fair to South Carolina. And so we want to make sure that everyone has skin in the game and is putting an appropriate amount of money as we initially designed. The federal match system, which is, again, I put in 90%, in this case, you put in 10%, should be respected. That's all we did for that portion of the bill.
And so basically, if there's a working person in North Carolina that needs Medicaid, you don't believe any of those folks will lose their Medicaid?
Well, if someone's sitting at home and doesn't want to try to get a job or volunteer or get educated and change their life for the better, then they are going to lose Medicaid. But that was the whole point of the law, was to make sure that if you really, really need Medicaid because you're in trouble, we have the resources to provide it to you. All of us pool our money together. Everyone watching pays taxes. We put it into Medicaid and take care of those who are vulnerable in our communities. Every great society does that. We're great people. We're going to do that. But if you start expanding it and putting people on Medicaid who are not pregnant women or small children. 53% of kids are born into Medicaid or CHIP. So we've got a lot of people to take care of. You don't want to take 25-year-old healthy men who are sitting at home watching television or playing video games and say, you know what, you guys stay at home. I'm going to have everyone else work harder to make up for that. That doesn't work as a system. And I know it's uncomfortable to say that, but I felt compelled to make that statement boldly. And that's what this law dictates, that folks got to go help themselves and help their neighbor. That's how the system works.
Back to the rural program real quick before we let you go. The obviously rural programs and rural hospitals are struggling, as you mentioned. This is a 5-year program. What do you think this does to the long-term future of rural hospitals in particular in this country?
So rural hospitals have half the occupancy, as I mentioned, of urban hospitals, but they also oftentimes have only 1 or 2 people in the hospital. They were created 50 years ago. They initially were going to have 100 people in the hospital. Now they're down to 10 people as a census normally, but they drip down to 1 or 2 patients. And that means people in the local communities don't trust them anymore. They don't even go to those hospitals. So we're trying to build those hospitals to be strong again, make them viable, make them high quality so people locally want to stay in those hospitals and trust to go to those hospitals. You do that by bringing modern technology to those institutions, partnering them up with bigger hospitals that are high quality in the urban areas so they have a partnership, a collaboration that makes sure that babies born in the small hospitals are safe like those born in the bigger hospitals. And we also do it by making sure that we have enough practitioners who are willing to work in those facilities. Telemedicine is a great example of that. If I can't get a specialist into your hospital, let me make it really easy to get a world-class expert on Zoom to be able to talk to you. And that's what this transformation fund is going to allow us to do. It issued yesterday my one plea to North Carolina, and I made this plea to your senators and your congressmen, but I really want to make sure that the governor hears this as well, because I've spoken to everybody, spoken to the governor as well, is make sure your best people put their best minds into this. We made it super simple. It's like going to a local diner. You've got all the recipes on the wall. Pick the things you like the most. You know, the chicken pot pie, if you like that, fine. Pick that metaphorically for the hospital system you're trying to help, but make some decisions, get some good people involved, and let's make rural healthcare healthy again.
When does this money start flowing, do you hope?
January, well, I don't hope, I know, January 1st. We're working through the holidays. So the issue, the request for funding issued yesterday. By the 7th of November, we're going to have all the applications in. We will decide over the next 7 weeks. By the end of this calendar year, all the money will be given out. And then our belief and our prayer is early in January, we'll start allocating some of this money.
All right, Dr. Oz, I know your time is precious. We appreciate some of it tonight. Good to see you.
God bless. Take care.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.